Mental health parity is something that you hear about, and I am by all means not going to be going into a long explanation, but this is a practice that was intended to correct some of the imbalances in healthcare, that physical health was treated differently than mental health. And what parity did was it required that when insurers offered mental health coverage, the benefits and costs to the insured needed to be substantially equivalent to similar treatments on the medical and surgical side. We had two significant steps toward mental health parity, one in 1996 and one in 2008. And these were really, really important steps, but they didn't do enough. The Mental Health Parity Act of 1996 applied to only large employer-sponsored plans, so basically 50 or more employees. They prohibited higher lifetime and annual dollar caps for mental health benefits in private insurance plans, which was really big. Taking away the caps meant that people did not max out their benefits. But it didn't address treatment limits or cost-sharing differences or limitations on how different facilities were covered. So, for example, being admitted to a psychiatric hospital could have been treated differently than being admitted to a general care hospital. And the critical piece is that there was no mandate that mental health care would be covered. Then, more than a decade later, the MHPAEA, the Mental Health Parity and Addiction Equity Act, it did apply to large group plans, but it did give them a way to get out of it. But again, the critical missing piece was that it didn't require that plans provide mental health coverage, only that if they did provide coverage, that the benefits needed to be on par with the medical benefits, so not more restrictive. The Act also prohibited separate deductibles for mental health benefits, and it did continue to exempt small group and individual plans, Medicare, and some other plans. So there were very great improvements, but it didn't get us as far as we needed to go. So what were the problems? There were financial exemptions. There was a delay in the final regulations that the final rules did not actually take effect until 7 years after the law was enacted. And that left a whole lot of time for providers and payers and people with mental health conditions to really grapple with, were they treating people fairly or being treated fairly? How could people who needed the care push to get the care? And really, how could you compare, therapy with a psychologist to say, what did it compare to on the medical and surgical side? It just really left a lot unclear, and people really fumbled about for quite a while. And of course, the essential problem was that, again, there was no requirement that plans offer mental health coverage.